Hi, live from the operating theatre here. I've got a few questions here. We're continuing the international theme because we've got American question here about a mummy makeover, and in homage to our overseas colleagues, I've spelt mummy with an O on the little bit that I've just written in there. So got a question from Leslie from America asking about a mummy makeover, which is basically a breast and a tummy procedure, usually a tummy tuck, and it can be a breast lift or breast implants or breast reduction or breast lift with implants. And I think, Leslie, you're looking for a breast, you're looking for your second lift, tummy tuck, and changing your implants for something with more projection. So, and you're asking about conical polyurethane implants, if they're going to give you more projection. Sorry, it's a radio's a bit loud. Sorry about that. Oh, I haven't got my head. I'm not prepared. I haven't put my ear thing in. What's the audio like? Dear. I'm going to live put the audio in. Buonasera. Yeah, happy Valentine's Day. Yes. I'm out for lunch with my Valentine. Actually, if I put that in, is that audio? There, that's better. Hello, Shirley. Nice to see you here. You're a big supporter on my Facebook. Thanks for commenting, etc. Can you hear fine? Oh, can you? Oh, is that better though? Is that better now? Put the ear thing in. I was just worried about the radio in the background. Anyway, I've done it now. So yes, so Leslie's looking for more projection. I wonder if polyurethane implants. We've got 450cc Mentor implants in. Now, whenever people talk about implants, they always talk about the size, like 450cc. It's the same. Is it the same? You're telling me it's the same as that? Is the audio the same? Whether I have the earpiece, have I had the earpiece in all this time for no reason? Thank you. Thank you for the hat. I'm glad you noticed. Yeah, glad you noticed. Yeah, it's one of my favourite hats, this one. So is this audio as good as with the headpiece in? Oh, I won't use that, I won't use that then. Better in. Right, let's get it back in. Yeah, so Leslie, if you're out there in America and you watch, you've got a question about the, yeah, we're in, don't worry, calm down, we're in. You've got a question about the projection and polyurethane and conicals. Conical implants do give the most, projection of any implants, or did, I should say, because conical implants are made by Silamed, and Silamed implants are no longer available, unfortunately, because I used to think the conical implants are very good. Well, I still do think they're very good, but so they're not available, conical implants, so we can't use conical implants. But so the important thing is to know what projection implant you've got in at the moment. So you say you've got 450 Mentor. The important thing is to know what projection it is, what width it is, and what the width of your chest is, to see whether you could have a bigger implant in terms of a bigger implant of the same projection, which would have to be a bit wider, which would depend on how wide your chest is. Or if you're already maxed out on the width with the 450 that you've got, you might be able to have a higher projecting implant if your implant at the moment isn't ultra high projection, which is what the Mentor highest projection ones are called. So that might be possible to get a more projecting implant, Leslie. Polyurethane makes no difference. Polyurethane won't make it more projecting or not. The polyurethane is because that's right. You want a second lift, don't you? Because you already had a lift and you want a second lift. So polyurethane will not make a difference, but you could have an ultra high projection implant. But what I would warn you, because and then you've got to look at shape. You have teardrop and round. If you have an ultra high projecting round implant, it gives a lot of fullness in the upper pole. If you want less fullness, you could have an ultra high projecting. Actually, I don't think they do ultra high projecting in teardrop. It's probably called something else, like extra high projecting, but it doesn't matter. It doesn't matter actually what it's called, but the highest projecting teardrop implant you could have, but it'll be slightly smaller. So less fullness in the upper pole, but slightly smaller, but a different shape that might be preferable to you. So yeah, you could. So there are options out there, Leslie, but I can't really say just by the email that you've sent with regards to whether you could have a more projecting implant because you've got a 450 mentor. I hope that's clear. The other thing is about second lift. If you've already had a lift, it's absolutely fine to have a second lift, but if you do a second lift, whoever does the second lift needs to know how the first lift was done. So if you're going to the same surgeon, then that's fine, but if you're going to a different surgeon, like if you're going to see me, I'd need to know the operation note from your first lift because I need to know how it was done, because there's different ways you isolate the nipple, and you have to isolate the nipple the same way the second time, otherwise the nipple can die. To put it bluntly, or you can have problems with the blood supply to the nipple if you don't use the same pedicle the same way. So that's the thing about a second lift. Anything else about Leslie? I think that was it from Leslie. So yeah, it's difficult when you're overseas, and you can always do a Skype call, but you really need to be examined. You need to know the base width of your chest. So it's difficult with emails to know about size of implants, whether they're right for your chest, because they might do bigger implants, but it's got to fit your chest. Width is critical. I'll always go on about that. The width is really crucial when you're looking at implants, not the size. 450 Mentor, there's lots of 450 Mentor implants. It depends on the width, and that'll depend on the projection. So a higher projecting implant will be narrower than a less projecting implant, be flatter, both 450. Amy, where are you? Have you just finished the surgery? Sorry, no, it's not a good question. I've got my consultation booked in with you for April, so excited. Yeah, Amy, correct, that is not a good question. In fact, it's not a question at all. Oh, is that the question? Where are you? I'm in theatre. Yes, I have just done a case, which I was going to talk about, but I'm going to try and do this in order. So I'm going to try and remember what I was going to talk about, because I haven't made any notes. It's all from memory. God help us. So that's Leslie. So I hope that's been helpful, but may not have been helpful, but really a consultation is the best way. And Leslie, the other thing I talk about all the time, if you're in America, I'm sure there'll be good surgeons in America. I always tell people to go local, just like if someone was here, was thinking of going to America, I told them to have it here, because there's a lot of good surgeons here. And so I would try and find a local surgeon if you can. You're looking for a board-certified plastic surgeon in America. In the UK, it's called FRCS Plast, is our certification. But especially on the specialist register with GMC, but yeah, I'd always try and go local if I could, if I was you. Leslie, just Mike has asked about tattoo on his thigh, and Mike's got a big tattoo on his thigh. I don't know if you're out there, Mike, but you've asked a really good question about the orientation of excision of the tattoo, and basically I would say that one of the reasons, if you've got a lesion, I mean this is on his thigh, but this principle is relevant if you've got something on your face. One of the reasons you would get a plastic surgeon to remove it is how you plan the scar, because we're always thinking about how we plan our scars, and basically Mike's got quite a sort of a long tattoo down the side of his thigh, and he wants a horizontal scar rather than a vertical scar. And there's a couple of reasons why I would actually do a vertical scar, unfortunately, so not the scar that you want. First of all, because it's oblong in a longitudinal direction, then if I was to do I'm not going to be able to get out in one go. It's too big to get out in one go. But if I do a vertical scar, it's narrower in the horizontal direction, so I'll be able to get more of it out if I do a vertical scar. I really need a flipboard for this, don't I? I need a chart to show you what I'm talking about, but it'll be easier to get it out. If I do it through a horizontal, because it's long and horizontal, I have to take loads of goes, because it's going to be like, really, I have to take 10 sessions or something ridiculous. It'll be a shorter scar, but it'll take much more sessions. So I do a longer scar, but less sessions. vertical. The other reason I do it in a vertical way is because every time you move your knee, move your leg, move your hip, it's going to be under much more tension if it's a horizontal scar. If you can imagine walking, obviously you're going to have to walk at some point after the surgery, presumably, it's going to be under tension if I do a horizontal. So those are the two reasons I would do a vertical scar. But when we're looking at scars, we're always trying to plan them in what we call relaxed skin tension lines. So if you're doing something on the face, you're looking at the relaxed skin tension lines. And if you want to know where the relaxed skin tension lines are, look at an old person. Because old people, where their wrinkles are, where their lines are, it's very clear. Young people never got, well, like myself, no lines. But if you smile and show your teeth, blow your cheeks out, you can see where the lines are. Oh, crikey, sorry. Carried away there. Sorry, back on. So that's where the lines are. So I started to segue in why you do a plastic surgeon to take your mole off from the tattoo question. But that's why, because we try and plan it in a line so that when it does fade, it'll fade into where the lines will be, even if you haven't got any lines. But not only that, it heals a lot better if it's in a relaxed skin tension line on the face. I tried to make that a bigger question than it was. But yeah, the other thing I thought about is just done a liposuction. And I've got a prop. So I've got a liposuction cannula. I don't know, can I use props? So this is a prop. This is a liposuction cannula. I just wanted to demonstrate this. If you can see the tip, look at that. Look at that. Look at that, live. That's the tip of a liposuction cannula. And can you see, oh look, I've gone, can you see how it's quite rounded? It's not really sharp. Actually, it looks a little bit sharp. But it's like a bullet. It's like a bullet. It's not really sharp. It's quite blunt, that tip. So if you're doing gynaecomastia, which is male breast tissue, so that's, liposuction is a part of doing the surgery, but often what you get with gynaecomastia is you get a dense piece of breast tissue underneath the nipple, just behind the nipple, and that liposuction cannula, or any liposuction cannula, that is a liposuction cannula, just bounces off that breast tissue. So I'll have to do this during surgery, but I'm not sure if that would run. But you could see it once I've done the liposuction. There's an obvious lump underneath the nipple, and you could. I wouldn't say a golf ball, but certainly a marble, like underneath the nipple, an obvious dense tissue. And this liposuction cannula is just bouncing off it. It's not removing the tissue. So that demonstrates, well, not that I am demonstrating it, but because I've just done it, but it does demonstrate why you often with gynecomastia need to make that little U-shaped incision, the lower border of the areola, and just cut out that dense tissue. When you go in and cut out that dense tissue, it's actually quite hard to cut out with a knife. It's really tough and dense, and so that's why it won't come out with a liposuction cannula, because it will just bounce off and it won't take that out. And if you leave it, then it's often a problem because patients can feel it underneath the nipple. So you often need to combine liposuction with excision when you do treating a patient with gynecomastia. So Valentine's Day, can't believe anyone's here. You should be out. Clearly, I'm about to go out myself because well, I'm not actually going to go home because I've got children. But hey ho, if you are going out, have a nice time. I better get home, see my family, and I'm checking out. Amy, great question. Where are you? That was a really good question. Thanks for that. Theatres was the answer. And consultation booked with you for April. So I'll see you in April, Amy. And if you have any questions, please email Laura. And if you have emailed Laura and I haven't answered them, sorry about that. I've been a bit frantic this afternoon. But I will definitely go over them next week. Tuesday, same time, 7 o'clock, and I will see you there. And thanks for joining. Have a nice Valentine's evening. Check it out.